It's a milestone no one wanted to reach.
There are 9,998 cumulative cases of coronavirus in the Victorian community, 723 new.
And the deadliest day of the pandemic so far, another 13 lives lost.
10 of those 13 are connected to aged care.
With 913 active cases linked to the sector, the federal government's taken over the worst-hit facilities, moving some residents to hospitals.
It may well be the case that there will be more transfers that will occur in coming days.
And in a desperate bid to contain community spread in the regions, from midnight tonight, people in 6 local governments are banned from having visitors in their homes.
You cannot visit friends, they cannot visit you.
Rules on masks that apply to Melbourne now extended to all of Victoria.
Midnight Sunday night, every single person in regional Victoria, when out of their home, will need to wear a mask or a face covering.
As authorities grow increasingly frustrated with people still going to work after testing positive.
To have found even one person who had disregarded their diagnosis and instead had decided to go to work is very disappointing.
New South Wales remains on high alert with 18 new cases and concerns for the Perisher ski resort where COVID was found in sewage.
While no cases of COVID-19 have been identified in Perisher or Thredbo, it's important that anyone who has been in this area gets tested.
2 of Queensland's 3 new cases are linked to Sydney's Apollo restaurant outbreak, the Premier standing by her decision to declare all of Greater Sydney a hotspot.
That is definitely the right decision that we have made to protect Queensland and Queenslanders' health.
But back in Victoria, her counterpart won't be drawn on his next big decision, whether to extend the Stage 3 lockdown.
One day's data is not a trend, and that's been borne out today. So I can't tell you where we're going to be in another 3 weeks. But I would just say to people, as challenging as this is, it is within our control, all of us as proud Victorians. If we follow the rules, if we play our part, then we can defeat this. We can drive these numbers down.
Australia's Deputy Chief Medical Officer, Dr Nick Coatsworth, is here, we hope, to explain why we shouldn't be freaking out. Nick, let's start with Victoria. What happened?
Well, 723 is a high number, Waleed, there's no doubt about it. It's not what any of us wanted to see. It's really focused the attention of the nation on how we're going to resolve this. Doctors and nurses around Victoria will have looked at that number and thought, when's it going to go down? Well, the numbers will come down, the movement restrictions will work, and I've said before on this show that it's going to take longer than we thought, longer than in the first wave, and the numbers we can see are bouncing around like a yo-yo. 290 yesterday, everybody thinks we're heading in the right direction. 723 today, it's the exact opposite emotion, so it's a real roller coaster for all of us at the moment.
Given what the Premier keeps saying about the drivers of this being workplace transmission, so people who are sick or have symptoms, they go to work anyway. This keeps happening. He keeps warning. It doesn't change. Does there come a point where the only available response really is to shut those workplaces down?
We have to stop this workplace transmission, and then it's up to us to work with the rest of government to put some advice about how that should happen. Now, whether that is more restrictions, whether that is shutting certain workplaces down, and you know, I think it's been fairly clear that there needs to be a debate on leave and financial support. All those are potential policy responses, but the issue is we can't have people going to work with COVID.
If I could move to aged care, Nick, given that it seems to be workers who bring the virus into these aged care facilities, has your office issued a directive to stop using transient workers across the country? We know they've done that in Victoria, but shouldn't that be a national action plan now?
The action plans have got to be tailored across the states, and different ones will be brought in depending on the number of cases you have. I think that sort of policy nationwide may cause workforce disruption, may cause issues with care of residential aged care residents. So it's just really important that we tailor those responses to how many numbers there are in a given state.
Do you share Premier Andrews' position that this is within control?
The trend is to have broadly the same numbers every couple of days. It's difficult to say, though, that with 723 we're at a plateau. That number needs to be responded to and has been today. The problem, though, is that we can't sustain those numbers in the medium term. you do run out of puff eventually with your contact tracing capability. And we've got contact tracers around Australia working remotely to help the Victorian government. But we have to see that curve not just flatten, but start to have decreased daily case numbers to allow the public health authorities and the health system in general to have a breath. So that needs to be the objective over the coming days.
Nick, the vast majority of Australians are doing the right thing, but it must be hard to govern dickheads. There are a certain small percentage of the country who are doing the wrong thing, not telling the truth. How hard is it to how big an issue is it when people just are not giving you the truth? Is it something you can factor into your own strategies?
No, in short. I mean, nobody would have expected that story to come out of Queensland, I have to say, and it shocked all of us that people who, and I've heard the two people in question termed teenagers. I suppose that's a technical view, well beyond the age of responsibility. They're young adults who knew what they were doing. And, you know, I would liken that, to be frank, in the pandemic to, you know, knowingly spreading an infectious disease, which is an offence for a number of different infectious diseases around.
No doubt about that, but are you really serious when you say no one could have foreseen something like this happening? I would have thought if you told me a story, there'll be some people who run around, lie to border authorities, do things they're not meant to do, that, yeah, of course that will happen. You hope it doesn't, but it's definitely going to happen, and then you've got to figure out what to do about that. Are you really shocked that this sort of thing has happened?
I think it's fair to say that we were shocked at how brazen it was, Waleed. I think we've all heard stories of people attempting to cross borders. This was remarkable for both its recklessness and its brazenness. But I think this, in part, comes to the question that we've had before about suppression versus elimination, and we have excellent processes in place to try and stop these things from happening. But when you've got 1 million people wanting to go into Queensland, as we just heard, you're going to get a few people there who don't obey the rules. So that means, it effectively means that no matter how perfect your processes are, you've always got to be vigilant.
Nick, thank you very much for speaking with us. We'll no doubt speak soon.
Thanks, Waleed.
Unfortunately, just before we leave that, some breaking news that is a bit grim. We've just learnt that a man in his 50s from the regional town of Portland in Victoria has died from the virus, so bringing that state's death toll today now to 14.